Right now, Alabama Department of Public Health Dr. Karen Landers told me masks need to be reserved for health care workers, first responders, and patients who need one. But for many of us who don't work in health care and have heard about N95 mask and surgical mask, here's a breakdown of the difference between the different types of masks. The N95 mask is designed to filter out particles, and prior to coronavirus, Landers said she used the mask to treat patients with tuberculosis. Landers said it has a different material and a tighter fit than a surgical mask and must be fitted properly on a healthcare worker to be effective. She also said it works to prevent respiratory droplets from a cough or sneeze from going through the mask and into someone else's nose or mouth who might be treating you. We've also got a lot of questions about KN95 masks and what's different about them. Landers told me the difference is basically where they're made. She says she believes the difference in names is because of the country where they're made. KN95 is from China. Now, a surgical mask, which is what people are most familiar with seeing, she said is what patients should use. Those masks prevent droplets from being dispersed if you were to cough or sneeze. Here's what Dr. Landers had to say about all these types of masks.
N95 is not a comfortable mask to wear for people that are not involved in health care, that have not been properly fitted for that mask. A surgical mask is more appropriate for reduction in transmission of droplets from the actual patient.
Now, we asked Karen Landers what kind of mask people who don't work in healthcare should use if the CDC does say that everyone should start to wear masks.
Should this come about, I do expect that the information that's being provided related to the use of cotton mask, sewn mask, will be one of the items that is considered for the general public should this come about.
Now, this afternoon in the president's briefing, they said it's a voluntary thing to start wearing a mask. But Landers stressed to me this afternoon that you should not rush to buy an N95 mask because those masks are important for doctors, nurses, and emergency workers to have them, and those are the kind of masks they need. Live in Huntsville, Sydney Martin, WAAY 31 News.